I am Dr. Upendra Kumar, a Senior Consultant Urologist at KIMS Krishna Institute of Medical Sciences, Secunderabad. Today's topic is urinary tract infections. As you all know, a lot of people suffer from urinary tract infections starting from childhood till elderly. So, what is urinary tract infection? Urinary tract infection is the infection of either the bladder or the kidneys. Usually it can occur in either of them. And what are the causes of urine infection? Usually in childhood the common causes are congenital defects, that means birth defects can lead to urinary tract infections like obstructions, PUJ obstruction or post-urethral valves, etc. And coming to the younger age, the common cause is stricture or dysfunctional voiding, otherwise called bladder neck obstruction. And in elderly males, the commonest cause is benign prostatic enlargement. And nowadays we are seeing usually diabetes is the very common cause. So that is the major cause of infections nowadays which we are seeing. And all the females do have urinary tract infections, and if the infections occur more than twice or thrice in a year, usually he needs a consultation by a urologist. And all the postmenopausal women do have these urinary tract infections for which they need to approach a urologist. And what are the symptoms? How do you diagnose urinary tract infections? The first and foremost is burning of urine. Second thing is frequency, that means patients needs to urinate more number of times either in the morning or in the night. He can't hold the urine holding would become a difficulty, it's called urgency, and some people do leak urine, and some people do have bleeding. If the urine infection is very severe, they can present with bleeding. And apart from this, which I said, there is a kidney infection that is called pyelonephritis. In this, apart from these symptoms, patient can have severe flank pain or back pain associated with fever. And in elderly people, they may not have this type of symptoms, but they may become drowsy, confused, and it may be an irrelevant talk, and patients may become very sick. So these are some of the symptoms of urinary tract infection. And how do we diagnose them? So usually the simplest test is complete urine examination, which can be done at any lab. It gives you presence of pus cells and some amount of bleeding sometimes and bacteria. And to confirm this which type of infection, we go for a urine culture test which tells us which type of infection it is and what antibiotic is sensitive for this. And apart from that, which I told, some people do require a test called uroflowmetry, which will tell us if there is any obstruction in the urinary tract. Like I said, in elderly people they can have a prostate problem, or in younger people they can have a stricture, or some people can have phimosis, that means the urine passage is closed, or some people can have any bladder neck obstruction, that is also called dysfunctional voiding. So we can know by the simple test called uroflowmetry, which is done on OP basis. And apart from this, patients who have frequent urinary infections, we need to do imaging, that is called ultrasound of the kidney, urinary and bladder. Apart from this, some people from the childhood do have the urination going back into the kidneys, that is retrograde flow, that is called vesicouretic reflex. These people require a special investigation called micturating cystourethrogram. So these are some of the tests by which you can come to a conclusion what is the cause of infection and how we can manage the infection. And patients having kidney infection, which is also called pyelonephritis, needs to be taken care, because this is called a complicated urinary tract infection, which needs to be where the patient needs to be diagnosed by means of a CT scan, and then he needs to be admitted, hospitalized for a few days till the fever subsides, and then he can be discharged. So these are some of the conditions. And apart from this, how do we treat these cases? The first and foremost is we need to the patient is advised to take a lot of liquids. Apart from that, we give him an antibiotic which can start from 1 day to 7 days depending on the frequency of infections. And then for prevention, we need to give certain antibiotics at a low dose in patients having recurrent urinary tract infection, that means more than 2 or 3 infections in a year. So those people need a long-term antibiotic suppressive dose and lifestyle modifications. Particularly patients having diabetes needs to control their sugars very strictly, and lot of water intake. Apart from that, they need to, there are some drugs which can prevent infections like D-mannose and cranberry, which needs to be taken in long quantities. And the last but not the least is, how do you prevent these infections? So there are certain things which need to be taken care. One is taking plenty of liquids, at least 2 to 3 liters per day in a spaced intervals. That means every hourly 1 to 2 glasses of water needs to be taken. Second thing, when we are cleaning, particularly in the women, the cleanliness is very important, hygiene. When they are cleaning, they should clean from front to the back rather than from back to the front. And third thing is some food modification, like patients should take a lot of high fiber diet so that they can prevent constipation, and particularly in elderly group, constipation is one of the cause for urinary tract infections because of mechanical obstruction to the urinary tract. So these are some of the important precautionary measures so that you can prevent urinary tract infections. And any male having urinary tract infection, either the boys or the gents, needs to be evaluated thoroughly to rule out any obstructive or reflux disease, because any male usually does not get any infection, and females get more infections because their urinary tract is very small. So the incidence of infection is more in females rather than males. So any patients having urinary tract infection needs to approach a urologist and try to treat immediately so that they don't get the complications like pyelonephritis or renal abscess or kidney failure at times, and some people do develop hypertension. Thank you.